Hello, everybody, and welcome to a new academic year. My name is Dr. Hina Gori, and I am an emergency physician. I have no financial relationships to disclose before this presentation. So you feel sick. Now what? Call your student health center for instructions about COVID-19 testing and follow-up. Remember, do not walk into the health center without calling them first and discussing over the phone. Stay away from others while waiting for your COVID test result, because if your COVID test is positive, you need to be isolating to prevent spreading COVID-19 to others. The incubation period is the time it takes from a person to be exposed to the COVID-19 virus till they develop symptoms of COVID-19. The incubation period ranges from 2 to 14 days, but typically lasts about 5 days. That means if you were exposed to a friend with COVID-19 today on Monday, you may not develop symptoms of COVID-19 until Friday. Unfortunately, the infectious period of that individual begins 2 days prior to symptom onset. So again, if you are exposed to somebody with COVID-19 on Monday and develop symptoms of an illness on Friday, you're actually spreading the COVID-19 virus to other individuals as early as Wednesday. You're contagious on Wednesday, even though you don't even know yet that you really have COVID-19. They are most infectious on day 1 of symptoms, but by the time 10 days have passed from symptom onset, they are no longer contagious. Individuals who have more severe illness can be contagious for 2 or more weeks. Individuals who are immunocompromised can also be contagious for more than 2 to 3 weeks. For this reason, individuals who have been diagnosed with COVID-19 need to isolate. Isolation means you must stay home except to obtain medical care. You must stay in a specific room and away from other people and pets in your home. You must practice proper hygiene and avoid sharing personal household items with others in your home. You can take over-the-counter medications such as acetaminophen or ibuprofen for body aches and pains, fever, or headache, unless you are told otherwise by a provider. You can also take over-the-counter medications for cough and congestion. Stay well hydrated. Most people with COVID-19 have mild illness and will recover at home without medical care. Tell your close contacts they have been exposed to COVID-19. Your school's contact tracer will also assist in reaching out to your contacts. Know the signs of a COVID-19 infection that is getting much more severe. Call the student health center for any symptoms including trouble breathing, persistent chest pain or pressure, new onset confusion, severe weakness, inability to wake up or stay awake, and bluish lips or faces. If your symptoms are very severe and you can't wait, call 911 immediately. Just be sure to inform the dispatcher on the phone that you might have COVID-19 so they can be prepared when they come for you. If you tested positive for COVID-19, you must remain under isolation precautions for a minimum of 10 days from symptom onset. Before discontinuing isolation, you must also be fever-free without the use of fever-reducing medications for 24 hours. And you must have an improvement in your symptoms prior to returning to school. Remember that patients who are immunocompromised or who have very severe illness with prolonged symptoms may shed the COVID-19 virus for longer and be contagious for a longer duration of time. Those individuals must check with their healthcare provider prior to determining when to end isolation. What if you are exposed to someone with COVID-19? If you have symptoms of COVID-19, start isolating immediately and call the student health center to get tested and for further instructions. If you have no symptoms, you must self-quarantine only if you are not vaccinated. Remember that a person who is infected with COVID-19 becomes contagious 2 days before symptom onset. When another individual is exposed to this person, they can have 5 days of incubation, followed by 10 days of signs and symptoms. This is the rationale why individuals who have been exposed to a person with COVID-19 have to quarantine for 14 days. Remember, even individuals who are asymptomatic will shed COVID-19 virus for up to 10 days. This is the rationale behind the need for unvaccinated individuals who have been exposed to a patient with COVID-19 to quarantine for 14 days. Again, quarantine is for exposed unvaccinated patients only. Asymptomatic unvaccinated individuals who have had close contact with a person with COVID-19 anytime during their illness and up to 2 days prior to the person's symptom onset must quarantine for 14 days. What counts as close contact? Close contact is being within less than 6 feet for 15 minutes over 24 hours, or having direct physical contact. So if you see a classmate at a distance of less than 6 feet for a 5-minute duration, 3 or 4 times in one 24-hour period, that counts as a close contact. Also, if you see another classmate very briefly, but you give them a hug, that counts as a close contact. Stay at home for 14 days when you're quarantining since your last contact with the sick person. Watch for any symptoms of COVID-19. Vaccinated individuals do not have to quarantine. However, they must still get tested 3 to 5 days after a known exposure, and they must wear a mask for 14 days following exposure or until their test is negative. Quarantining is also not necessary for someone who has had COVID-19 illness within the previous 3 months and has recovered and remains without COVID-19 symptoms. Our understanding of the COVID-19 virus is changing on a nearly daily basis. The Center for Disease Control and Prevention's guidelines will change regularly as we learn more and more about the virus. Stay up to date with your information. Turn to your school's leadership and your healthcare provider for the latest protocols and guidelines, and check out the CDC's website and the New Jersey Department of Health's website. Good luck and have a happy and healthy 2021 to 2022 school year.